The number of people getting pertussis, commonly known as whooping cough, is on the rise in La Crosse County. It's the largest outbreak the state has had in 8 years. That's why health experts are urging community members to be aware of the symptoms and make sure they're up to date on their vaccinations. News 8's Carrie Vick joins us with the details. Carrie?
Lisa, whooping cough is passed by face-to-face contact. So once someone's infected, it can spread like wildfire. That's why La Crosse health officials are worried about the increase of cases in our area. For some, pertussis or whooping cough can just be an annoying cough that won't seem to go away. But for others, it can be life-threatening.
People should understand the severity, whereas some of us will be lucky enough to have potentially a mild cough from an illness such as this. There are those in the community that this is quite a grave illness and actually can be deadly.
Which is why a spike in whooping cough cases is causing concern for health officials in La Crosse County.
Since last Thursday, we've had a total of 17 cases alone in La Crosse County.
And the increase is not limited to the La Crosse area.
The current pertussis activity is at a large outbreak status in the state of Wisconsin right now. And we haven't seen this type of activity since 2004.
Pertussis is a bacterial infection that begins with cold-like symptoms, a runny nose, and a cough that gets worse over time, making it difficult to detect early on.
The trouble is we're in the midst of prime allergy season, so when we say what are the onset of symptoms, what should we be looking for, that runny nose, the sniffles, a lot of those things are other things are going around in our community. We're still seeing sporadic cases of influenza. So how do I differentiate and know when I actually have pertussis versus when I have something else?
Most definitely the preventative measure vaccination, being proactive about it, especially given that we have an outbreak. And at the first sign of any symptoms that you have that you think may be related to potential whooping cough, give your provider a call.
Health experts say even though the infection is most dangerous for young children and those with a compromised immune system, everyone should make sure they're up to date on their vaccination.
We have to maintain the thought that not only is this vaccination necessarily for me, but it may be for my significant other, it may be for someone in my family who's at risk. So it really is what we call a herd immunity.
Now, even if you were vaccinated for whooping cough as a child, health experts recommend a vaccine called the Tdap, a one-time booster for adolescents and adults. I was told today that a one-time boost might not be enough anymore, so the best way to be certain you're up to date is to call your healthcare provider.
All right, thank you, Carrie. This year alone, we've already seen more than 900 cases of whooping cough in Wisconsin. That's 700 more cases at the same time last year.